The Aged Care Royal Commission found that neither the Commonwealth Department of Health nor the Aged Care Regulator had any specific plan for the aged care sector. Now, all governments mouth cliches about dignity in old age. Every aged care facility to be accredited is expected to have infection controls in place. But hundreds of aged care Australians died in aged care as a result of coronavirus. And the Royal Commission found that across the aged care sector, there have been failures in clinical care and infection control, which failures have resulted in hundreds of deaths. Yet residents pay a small fortune for a place in an aged care facility. The Albanese government has promised 24/7 on-site nurses, more care hours per resident, and to fund a pay rise for aged care workers. None of that's happened, but one can only wonder what kind of care these 200,000 residents in almost 3,000 aged care homes are receiving. The entry-level pay for an aged care worker is $21.09 an hour, less than that for a supermarket shelf stacker. Sadly, pay alone, as CEDA has reported, won't be enough to solve the workforce challenge. So far, 2,700 nursing home residents have died from coronavirus. More than 42,000 staff have contracted coronavirus. More than 650 out of the almost 3,000 residential aged care facilities are currently dealing with a coronavirus outbreak. Now, I'm sure the Treasurer knows that, but he's worrying, of course, about how far expenditure can travel ahead of revenue when you've got $1 trillion of debt. Already, aged care is a massive item in the budget, $22 billion a year, employing more than 360,000 Australians. But think for a moment what onerous, demanding and physical work is asked of an aged care worker. And for their trouble, poorly paid. Carers are leaving because they can earn significantly more money in other areas of the care economy, including disability care and the general health sector. The Health Minister, Mark Butler, is saying he will introduce laws next month to reform aged care, including 24/7 nursing in residential aged care from July next year. But that will require an additional 14,000 nurses. Where are they going to come from? Do we find carers from overseas to enter a demanding and poorly paid environment? Why aren't personal care workers added to the temporary or permanent skilled migrant list? Create a new visa, as I said earlier tonight, an essential skills visa. Let them in if they've got the skills. According to the paper by the Committee for Economic Development of Australia, the real crisis in aged care is that even if the sector can find an additional 35,000 workers a year additional, that would only bring aged care up to a basic standard. To bring aged care in Australia up to international best practice would require a further 8,000 additional workers. When we talk about change in Australia, the one change we don't talk about is attitudinal change. The attitude of families towards their elderly members has to change. We can't keep asking government to do everything. This is one sector where I doubt we'll ever be able to afford the resources it needs, which sadly means the abandonment, at least partial, of the elderly. Every one of us one day will have at least one elderly member of the family. The provision of dignity to that member shouldn't be left to government alone.